Hi, I'm coming to you on location this morning. As we walk across downtown outside of the Ramsey County East building, I wanted to show you some of our new service delivery options we've been opening up through this coronavirus emergency response. Ramsey County is now offering 6 drop sites across the community. 3 in suburban Ramsey County at the regional libraries of Shoreview, Roseville, and Maplewood, and 3 downtown. 1 here at Ramsey County East, and another 2 at Ramsey County Courthouse, as well as the Plato building on the other side of the river. The goal of these drop boxes is to ensure that all of our documentation from residents can be collected in one place, and then we will do the work to sort through it. I know there are questions that come with this. Is it safe to handle materials? What is safe right now as we learn more and more about COVID-19? And so today I'm going to turn the video back over to Dr. Lynne Ogawa, Ramsey County's medical director, to share some more with you. Thanks for tuning in.
Hi, I'm Dr. Lynne Ogawa. I am the medical director for St. Paul Ramsey County Public Health Department. I always recommend washing your hands before you begin handling things. This is actually more about just preparing to get into the mindset of lifting things and carrying them and moving them. Don't touch your face while you're handling any of those materials, and then wash your hands immediately after you've finished through those materials. Since the virus doesn't pass through skin and it isn't put back into the air by things, gloves and masks just aren't helpful in this situation. This is probably one of the most frequently asked questions, and probably the one that makes people the most nervous, because there's been a lot of information in the media about this. Our best study in the New England Journal of Medicine, which looked at actually putting the virus, live virus, on a surface and then monitoring it to see how long live virus stayed there, showed that it stayed on that surface for up to 3 days. There's been other studies that looked at testing for viral RNA, which is just the sort of body parts of the virus. That showed that it could last up to 10 to 17 days, but they didn't look for live virus. They only looked for RNA, and that could be from live or dead viruses. And we know that only live viruses can spread the disease. Now, having said that, the best way to protect against this is to wipe down surfaces with cleaners, because that kills the virus, whether it's been there for a day, an hour, a minute, but that kills the virus. And then also, washing your hands after touching things also washes the virus off your hands and kills it, so you cannot spread it to yourself. So personal protective equipment has always been recommended when caring for a sick individual. Now it's even more important to be only using PPE in the highest and medium risk exposures because of a real and very serious shortage in healthcare of those things. We have shortages of masks, standard surgical masks. We also have shortages of the N95, which are the even more safe to wear in high risk situations. And so we really need to be mindful of having the people who need the PPE the most have access to and be utilizing that protective equipment. I know that may scare some people, but the things that we outlined really protect us better than that PPE in lower risk situations, because sometimes using gloves or putting a simple mask on makes us feel safer, and we don't follow the things that we really need to follow to protect ourselves.
Dr. Ogawa, I just want to say thank you again for being willing to record this video today. I hope it was helpful to all of you to see some more about safe handling practices during the COVID-19 outbreak and realize we will be in this service delivery redesign for a while, and so it is important that we heed the advice of our medical professionals. I hope you all have a great day, and I encourage you to continue visiting www.ramseycounty.us/coronavirus for all updates on our service delivery model, as well as information about changes to services or anything else on our employee page so you can stay informed. Thank you. Have a great day.